How you doing? Dr. Chris Cueto from Herald Chiropractic and Sport. I'm here with a post-surgery of a repair for an ACL tear on his gentleman's left knee. He's actually came in here a couple weeks ago requiring some my attention. Again, first thing I wanted to do is actually start working on his spine, clear out any type of spinal mechanics. At the same time, start working on his knee in terms of rehab as well as break off any scar tissue. Just kind of give you an idea what an ACL is. An ACL is a major ligament holding holding your knee joint in place as well. He injured it playing basketball, coming out from a rebound, came out and actually did a nice twisting motion as well. It wasn't very pleasant for him, so he needed some actually some major medical attention. It's repaired. Here he is. So after I cleared out the rest of his spinal biomechanic discrepancies, allowing nerve flow to the knee as well as allowing him to move better, I'm actually now to the point now we're actually breaking off the scar tissue around his knee. So in order to do that, we're going to do this using the FAKTR method. Again, he's going to be in a static position, and as I go through around his knee itself, we'll actually feel some bumpiness or even some rigidness structure around his myofascial area. Like for example, here you've got some bumpiness here. You feel that, right? Mm-hmm. Okay, that's where all the scar tissue is. Relatively gentle, breaks off anything else, any type of scar tissue within a matter of seconds to even a minute. Maybe go down straight to his IT bands and even to his quads, since they act as a pulley mechanism around his knee this way. Now, after a couple of visits or a couple of treatments, we will start seeing some better functionality with it. We could actually get him into a little bit more functional or exercise as I do the FAKTR method. So we get to flex and extend, and eventually even without me as well. We may even add some resistance to it too. I may even flip him over, start working on his hamstring area, go static, and then eventually using some resistance weights as well with a TheraBand or even an ankle weight. Eventually, once he starts moving back, he feels less discomfort with his knee and better movement of the spine. We can start him off onto higher level type of exercise, first with squatting exercises and eventually some balance techniques with it too, with let's say a Bosu ball or a stability trainer. Again, not just strengthening the knee and the quad area, but also his core and his glutes. Okay? At the same time, still maintaining any type of spinal adjusting that needs to be done. Okay? So if there's any questions, you can contact us at www.heraldsquarechiropractic.com. Again, this is Dr. Chris Cueto from Herald Chiropractic and Sport.